Hello, I am Susan Baumgaertel, and welcome to Navigating Your Health with myMDadvocate, Episode 3, I Need Caregiver Support. So much to talk about in so little time, but let's just kind of plunge in with things that maybe resonate with you. This is a fill-in-the-blank one. Your blank needs support, but you are feeling overwhelmed and stressed. So that blank could be your parent, your spouse, your friend, your grandparent, your child. So you can fill that blank in. You are not even sure where to start with accessing support. You need guidance on how to prioritize your needs without feeling selfish or guilty. That resonates with quite a few of you, I'm sure. Or you have put so many of your personal needs on hold, and now you don't know how to create a better long-term balance. Emphasis on long-term. Or if you don't get any help, you feel, like you're going to start to fall apart. I'm sure that hits home with some of you. So this is not a therapy discussion, but more of an awareness chat. So for movie buffs, it's like the movie Inception, if you remember that. Diving deeper into levels of a dream within a dream within a dream. For those who are more culinary inclined, it's like peeling back multiple layers of an onion. Yes, crying might be involved. So how to even start thinking about caregiver support? And I think that's kind of that, $64,000 question. So let's dive into some of the different levels and peel back some of those layers. I'm going to categorize things in kind of 4 separate areas. One is kind of more like a systems perspective, what systems are in place. And I mean systems for patients and for caregivers. So, a lot of folks are aware of the hospital discharge process. There's so many moving parts to that. It could be getting someone into a skilled nursing facility or into a rehab center or a nursing home or back home. And boy, it takes a village. And then there's the home care professional aspect of systems. And so nursing support, occupational therapists, physical therapists, wound care specialists. I mean, I could go on and on. I don't want to list everybody because I know I'll leave someone out, but really there's quite a team there that often is involved in the home care support process. Then there's, the services needs. So the pharmacist, all those prescriptions, oh my gosh. Mediset, that's a little pill box, right? You open up the days of the week. Sometimes it's morning, midday, evening, and nighttime. So it's like a massive pill set. Or maybe it's DME, that stands for durable medical equipment. And again, there's so many other things that are kind of in that services category. And another kind of systems aspect would be physical needs. So does someone need a hospital bed, a shower chair, maybe a bedside commode, or a wheelchair, or a front door ramp? Again, this list is just huge. And I know that everyone can add to it probably without even taking a moment to think. So that's kind of the systems aspect. Another layer or another depth of kind of looking at this would be the relationships that are defined. Again, relationships on behalf of the patients and on behalf of the caregivers. So there are medical relationships, of course, physician, of which I'm one, nursing, social work, again, the list is long, you get it. There's the immediate environment relationships. Is it safe? Is it accessible? Is it comfortable? If there's a storm and the power goes out, God forbid. Their family relationships. And by that, are they dependable? Are they far away on the East Coast, West Coast? Are they in the same block? Are they in the same house? And, those intricate dynamics that interplay when it comes to family involvement in caregiver roles. And then friends, there's a lot of overlap, but, friends are not always the same as family. Sometimes they might be easier. Again, are they reliable? Are they near? Are they far? And so forth. And then, the other layer of relationships, of course, is community, and not just community members, but community services. So then the third category in this kind of level and layers exercise would be needs. And now what I mean by needs is needs of caregivers. So think about that. Some of them are kind of obvious, but some of them are a little obtuse. So I like to, think of them in kind of some kind of simple terms. So nutrition, nourishment, are you getting food? Are you skipping meals? Is it grab and go? Do you have time to shop? And again, I'm talking about you, the caregiver, not the patient. Movement, and notice that I say movement and not exercise, because sometimes exercise seems almost like a punitive word. So movement, daily movement. Do you have a routine? Are you modifying it? Is it completely hit and miss? Is it out the window? That is something to think about from a caregiver needs aspect. Sleep, gosh, quality, quantity. I honestly think quality is more important to gun for when you're thinking about sleep. But if you're a caregiver and you're woken up every hour and you have to attend to the patient, so to speak, your patient, then that's affecting the quality of sleep and certainly the quantity. Are you sleeping on a couch? Maybe there's no guest room. That's is this an unfamiliar environment? That can certainly impact your needs, especially when it comes to sleep and restfulness. Stress. Oh gosh, kind of sounds like good cop, bad cop. Good stress, bad stress. Good stress. The act of love or kindness or caring. There's nothing wrong with that, but that can be stressful. Bad stress, dare I say, you're changing a bedpan, or someone who may have had an accident in the bathroom or the bed sheets for the fourth time, and that's challenging, especially if you're not a nurse or not used to this kind of role as a caregiver. And sometimes the stresses are obvious, like I mentioned. Sometimes they're hidden, and it's hard to even recognize and hard to even acknowledge. And then there's connection with others. Again, that's a very inherent need for caregivers. Many don't have time, where they just, they're far away and they've moved temporarily to be a caregiver, or they're so overwhelmed that's the last thing they're thinking of is their friends or people that are meaningful to them. So I know that's almost a given. Then the fourth category, I'm going even deeper. So I call these deeper needs, again, for caregivers. So think about personal health issues. Are you keeping up? Lord knows it's hard to kind of get an appointment anyway these days, but to spend time on yourself for your personal medical conditions, maybe seeing your doctor, maybe, going to the pharmacist for yourself, and so on and so on. Mental health. So many people are already dealing with things like depression or anxiety, and their caregiver role is just almost overwhelming, and really sometimes brings back a PTSD feeling. Maybe you have already done this for another relative, and now it's like, here we go again. So that's can be pretty intense. Work demands. We have a 24/7 culture, right? And so is your job flexible? Is your position even one where you can have flexibility? And many people end up going on FMLA, family medical leave. And is it paid? Is it not paid? So those are all kind of, deeper needs that need to be addressed. Family responsibilities. Do you have kids? Say no more. Even if you don't have kids, there's so many complexities that really can just layer on those kind of stressors. And then, there's a word resilience, and I kind of hesitate to use that sometimes. I think it's been overused, rightly or wrongly. But truly, in terms of thinking about resilience for that deeper need for the caregiver, is your role as caregiver sustainable if this is a longer term journey? Can you job share? And by job share, I mean caregiver job share, not your job if you have one. So those are kind of, 4 different ways to look at different levels or different layers. And let's just pause for a moment and just kind of, let that sink in. Are you feeling just a little overwhelmed right now? I kind of am, just even talking about this, and I know many of you are. So notice that in my discussion about all the layers, there was a shift from patients to caregivers, and that is where I want you to focus. So it's easy to get stuck in that systems and relationships sections. They're just often more immediate, they're urgent, especially if there's back and forth to the hospital and the ER and so on, and doctor calls and medications and really urgent needs. But it takes intention to focus on the needs and the deeper needs layers, those second 2 I was talking about. So do you need support? Caregiving can be both wonderful and exhausting at the same time. Maybe you need a therapist or a counselor, or you already have one and you need to make a connection with them. Absolutely valuable. Do you need a good friend? A good friend is not going to be put off if you ask for a couple of food items, maybe a meal. You can put in your freezer, or maybe a meal delivery service. Maybe it's just a phone call. Maybe it's just a text. It's reaching out. And I think that's really key. And that kind of goes really for community connections as well. There are many resources. A great example is if you're caring for someone with Alzheimer's, there are many community, local Alzheimer's support groups for caregivers as well. And so there are ways to avail yourself of these services. That's really key. And really, I think the art of listening sometimes feels like a lost art. So I'm listening to what I just said. Instead of, how are you? Sometimes hearing, hello, nice to see you, can be a big relief. Asking a question of a caregiver can be sometimes overwhelming, like, how am I? Okay, well, do I put my game face on? Am I good? Or am I exhausted, overwhelmed, or just I didn't even sleep? And like, did this person asking me, did they even want to hear that? That was just kind of a greeting. So maybe remembering saying, hello, nice to see you, that can be a huge relief. Being comfortable with silence when you're with someone. Silence can be gentle, can be forgiving, and can be just filling a little space and time, and makes you feel good. You don't have to fill it up. And remember, not every problem needs to be solved. Oh boy, I think that is huge, and I hope people remember that. I'll say it again, not every problem needs to be solved. So make a plan and change it up as you need it. I'm going to kind of give you this acronym I just developed. It's DAIS, and if you look in the Oxford Dictionary, the word DAIS, excuse me, I had to learn how to pronounce that. DAIS is defined as a low platform for a lectern, a seat of honor, or a throne. Oh, you didn't know you were on a throne, huh? So DAIS, DAIS, delegate, ask, identify, set boundaries. So delegate. You don't need to do everything. Really, truly. You may feel like you need to do everything, but you don't. Ask what is needed from you. How can you help? How can someone help you? Very key question. Identify, how are you coping? How are you feeling? Do you need to make changes? And that's very introspective. Set boundaries. Learn how to say no. Practice NO. No, you don't have to be nasty. Just one word, no. So DAIS, think about that. And I'm going to just kind of pause for a moment, because those pauses are golden. I hope you are thinking about these. Thank you for listening to me. I hope you enjoyed spending a little time learning about how to think more intentionally about caregiver support. And I hope you'll join me again for episode 4 I want to age with intent. Thanks for listening.